Hi, I'm Lindsay Mabry, and today I'm going to be talking to you about ARDS, pulmonary blood flow, and prone positioning. What is ARDS? ARDS is acute respiratory distress syndrome. Acute respiratory distress syndrome occurs when fluid builds up in tiny elastic air sacs in your lungs called alveoli. This occurs from the pulmonary capillaries becoming engorged and the alveolar capillary membrane becoming more permeable. Because of the membrane permeability increasing, interstitial and intraalveolar edema and hemorrhage ensues, as well as scattered areas of hemorrhagic alveolar consolidation. More fluid in your lungs means less oxygen you can reach your bloodstream. This causes a decrease in alveolar surfactant and causes alveolar collapse, also known as atelectasis, which can lead to the intraalveolar wall becoming lined with thick, rippled hyaline membrane. This membrane contains fibrin and cellular debris. This can lead to hyperplasia and swelling of the type 2 cells. Fibrin and exudate develop and cause intraalveolar fibrosis. This process deprives your vital organs of oxygen they need to function. ARDS typically occurs in people who already are critically ill, who have significant traumas. The main symptoms of ARDS is severe shortness of breath. This usually develops within a few hours to a few days after the original disease or trauma. Many people who develop ARDS do not survive. The risk of death increases with age and severity of illness or injury. The people who do survive ARDS, some recover completely while others experience lasting damage to their lungs. And this is just a chest x-ray of what acute respiratory distress syndrome looks like. This one over here is a normal chest x-ray. This one right here is the one that the patient has ARDS. If you look closely, it's kind of hard to see on this x-ray, but it looks like it has the ground glass appearance, and that is a characteristic of ARDS on a chest x-ray. Pulmonary blood flow. Pulmonary blood flow is the passage of venous blood, also referred to as deoxygenated blood, from the right atrium of the heart, then goes through the right ventricle and pulmonary arteries to the lungs. Once blood enters the lungs, the blood then passes through the pulmonary capillary where gas exchange takes place. The gases then diffuse through the alveolar capillary membrane where it picks up oxygen and releases the carbon dioxide in the blood. Once oxygenated, the blood then returns via the pulmonary veins to the left atrium, then goes through the left ventricle to the aortic arch, and then enters into the pulmonary system to provide oxygen to your vital organs and tissues in the body. And this is just an illustration of pulmonary blood flow. It's just what I just went over. This right here is the systemic side of the systemic circulation. This is the vena cava, and it's going up, and it's going into the right atrium. Then it goes to the right ventricle. through the tricuspid valve, and then from the right ventricle it goes into the pulmonary artery, and then from the pulmonary artery it goes into the lungs and into the pulmonary capillaries, and then gas exchange takes place right here, and then the blood flows back to the heart via the pulmonary veins. It enters the left atrium, then it goes through the bicuspid valve, and then the blood flow goes to the left ventricle, and then it goes to the aortic arch, and then to the aorta, and then it goes to the body. What is prone positioning? Prone positioning is where the patient is lying face down on their chest and stomach, or ventral side down and dorsal side up. Prone position has been shown to improve oxygenation in patients with ARDS or ARDS during prone positioning. Ventilation and oxygenation is improved due to the changes in the pleural pressure and the amount of lung atelectasis present. And this is just a picture to show you normally flat on your back. It's called supine. That's how you normally lay in a hospital bed. But this is what we're talking about. This is the prone position where you're laying on your stomach.